Okay, let's go ahead and get started. Welcome, everyone. Today, we're going to be discussing how HCA Healthcare hires permanent nurses. This is part of Incredible Health Speaker Series, where we have top leaders and executives from across the country join these webinars and speaker series to share their strategies, their tactics, their philosophies on how they're solving some of the top challenges that we're all facing today around hiring permanent nurses, and in some cases even how to retain the nurses too. My name is Iman Abu Zaid. I'm an MD by background. I've been in healthcare technology for the last 10 years of my career. I am the CEO and co-founder of Incredible Health. Incredible Health is a career marketplace for healthcare workers. We are the fastest growing career marketplace for nurses in the US today. And our our platform is used by hospitals and health systems to hire nurses in permanent roles in 20 days or less. It normally takes 60, 70, 80 days or longer. We flip the script where hospitals apply to the nurses instead of the nurses applying to the hospitals. Joining us today, we have Stephen MacDonell, AVP of Talent Acquisition at HCA Healthcare, dialing in from Nashville, which is where HCA's headquarters are. Stephen has over 15 years of experience in healthcare talent acquisition. He oversees 8 divisions at HCA. That includes 95 hospital locations and over 200 talent acquisition team members. As many of you attending know, HCA Healthcare is the largest or one of the largest healthcare systems in the country, with 185 hospitals, 2,000 care sites, and a workforce of 250,000 people. Stephen, thank you so much for being here.
Absolutely. Thanks, Iman. Happy to be here.
All right. We are recording the session today. And so for those of you attending, you will be getting the recording afterwards as well. And this is designed to be interactive. So we have Q&A available. So please feel free to submit your questions into the chat, and we'll answer them as we're going along. And we've also set aside time at the end of this call to go through Q&A as well. So please don't be shy, submit as many questions as you like. Quick disclaimer, Stephen is not representing HCA Healthcare. All of his opinions are his own, based on his 15 years of experience in healthcare and hospital talent acquisition. So what we're going to be doing today, we're going to do a quick overview of the nurse labor market, and because it is a very rapidly changing dynamic market. And so I'll be just sharing what the latest data is nationally. Then Stephen will be sharing how to become the employer of choice for nurses, how to build a nurse hiring machine. That includes the operations, the analytics, the people that drive nurse hiring. And then we will be reviewing as well how Incredible Health can help as well. As part of the section around becoming the employer of choice, we'll be covering the care models that HCA uses, the career development plans that they have in place to drive nurse hiring and nurse retention, as well as flexibility in nurse scheduling too. All right, so let's dive into the market overview. Let's just set the table here. Healthcare is the biggest labor sector in the country by number of workers and by dollars spent on the workers too. 1 in 8 Americans works in the healthcare industry. Since 2018, we have been the #1 employment sector. But our industry has a very, very difficult problem in that the demand on our healthcare system continues to increase, but the supply of workers, and that includes the clinicians, that includes the nurses, is not keeping up with that demand. This was a problem long before the pandemic. The pandemic exacerbated it, and we are projected to continue facing this problem for many, many years to come. Just looking at some of our more recent stats, this is a national problem. Every single geography deals with this challenge in different ways. Overall, we're on track to be 1 million nurses short by 2023. And the other thing is our annual nurse turnover for acute care in particular has gone up. It's currently at 21% average. Before the pandemic, it was at 18%, so it has gone up by 2%, which is quite a big increase in just 18 months. Also, 48% of revenue is being spent on labor. So, and that number is also consistently going up. And we're not just talking about temporary labor or premium labor, but even permanent nurse labor is increasing as that's what happens when you have a labor shortage. Their salaries go up, their signing bonuses go up, their retention bonuses go up, and compensation overall goes up. And so health systems are having to spend more and more on the labor. And then also the average time to hire is at 82 days. That's the national average. There's some teams, I'm sure Stephen has some divisions that are much lower than that. But then there's always some roles that are higher than that. But roughly what we're seeing is a national average of 82 days to fill. Right. All right. So just quick before we transition to Stephen, just wanted to highlight some of the top reasons why nurses are leaving their jobs. Career advancement is the number one reason why nurses change jobs. Every time a nurse creates a profile on Incredible Health, we do ask this question. Flexible scheduling is the second reason, most common reason. The third most common is reducing commute times and or relocating, so something to do with geography. And the fourth reason is compensation. So before we dive into that, I'd love to hand over to Stephen. And if the first question we have for you is, can you just share with us a little bit more about how the pandemic has affected nurse retention and nurse hiring at HCA Healthcare?
Yeah, certainly. We at HCA Healthcare haven't been immune to, I think, the larger effects of the economy or the healthcare industry as a whole. I'm sure many of the same challenges that you all on the call are facing. My team and I, obviously being in recruitment, we're much more focused on the front door of the organization. And so while you can't be successful without both recruitment and retention, I think where, myself and my team have been affected by the pandemic the most is really on that increased need for skills at the bedside to not just care for COVID patients, but, after the economy opened up, really to care for all types of patients again. And that's been really hard, I think, on caregivers at the bedside, which shows up obviously in our retention numbers and need to hire nurses. But it's also been particularly hard, I would argue, on our recruiters and the increased demand on them. And so I think that's important to call out as well. And then you take those challenges, you spread them across 185 facilities, 275,000 plus employees who are caring like family. It's a big challenge for us. One of the historical strengths that we've always had at HCA Healthcare to kind of combat, recruitment and retention has been our efficiency and speed. But, as more of the market over time has mimicked that kind of competitive advantage for us, it's turned, I think, to a greater need for us to continue to iterate, continue to drive those efficiencies and ensure that we truly are creating that best-in-class process and working it every single time a nurse enters our ecosystem. And so that's been a big focus of ours based on retention and recruitment over the last 18 months. But out of that adversity comes certainly opportunity. And one thing I really want to highlight is our team has really more than responded to that opportunity. We're on pace to fill well over 40,000 RN positions this year. And so I'm really incredibly proud of the efforts and the results that our recruiters have created through their hard work. And then, I've been able to be a small part of. So.
Okay. So yeah, I mean, we can definitely confirm that HCA is one of the most operationally efficient, analytically driven teams that we work with at Incredible Health. And it's been a huge competitive advantage. We mentioned earlier the reasons why nurses are changing jobs, right? The number one reason is looking to advance their careers. The second is looking for more flexible schedules. The third is wanting to reduce their commute times or relocating. And then the fourth is compensation. I think many HR, talent acquisition, and nursing executives are surprised that compensation is actually number four. I think many assume that compensation is number one, and that is in fact not at all the case. So one area we'd just love to dig into more, Stephen, is how you're positioning, how your teams position HCA as an employer of choice for nurses.
Yeah, and that's the magic question. If I had the perfect answer for it, I'd be retired by now. But I can tell you some of the things that I think really resonate with any industry or anyone in healthcare is you really have to walk the walk and talk the talk when it comes to creating that employer of choice environment for nurses. If your health system is a great place to work, it doesn't matter how much you say it, how you advertise it, nurses know it. And the same is also true on the reverse side. And it's interesting for us, one caveat we have, 185 hospitals with a national brand for executives, vendors, industry partners. But to the everyday nurse, they may not know who HCA is because of the local branding we historically had. And so one of the things we've really been trying to solve, and not just creating that employer of choice, but telling that story, is building that national HCA brand that resonates with RNs across the country in all of our markets.
Okay, just tactically speaking, is this part of recruiter training at HCA? Are they explained, do they know how to quote unquote sell the HCA brand, even if a nurse is not aware of who HCA is?
Yeah, I want to say yes, and I will say yes, but I'll put the caveat on there that it's an area that we continue to train and develop on, and so to say that we've got it perfect and nailed down, I think would probably be a bit of a misrepresentation. But yes, it is something we are consciously trying to drive. Is how do you tell that story, not from our language, but from the language of the nurse?
Got it. Okay. Um, and so how are you thinking about becoming this environment that's great for nurses to work? Like, how are you differentiating? Yeah.
Um, Yeah, it comes back to that environment certainly, but one of the key, I think, differentiating things that HCA can offer that we're really pushing here in the last 12 months is whatever you want to do in nursing, we have it somewhere in the company. So if you want to be a travel nurse, a staff nurse, if you want to go into operational leadership, finance leadership, nursing leadership, research, whatever it is you want to do, we have that opportunity here within the four walls of the company. And so one of the things we like to say is, with HCA healthcare, nurses have the ability to work how they want, when they want, and where they want. So we can offer opportunities even for nurses that, in a location where we don't have a physical presence, because of the partnerships we have in the industry. And one of the things I think that's really exciting and about creating that environment of choice for nurses, it is very possible here at HCA Healthcare to have 3 or 4 or 5 very unique and different careers over a 40-year span, all with the same company, where you never have to leave your benefits, you never have to leave your tenure, and perhaps most importantly, you never have to leave your work family, just because of the breadth of the healthcare industry that we touch. And I think that ties to brand, for us, and operationalize it, because we're telling that story, that HCA healthcare story of what we can offer in a way that we really haven't in the past, or at least as loudly as we have in the past. So very much more focused on what's in it for them, what's the value that they get. So education, growth opportunities. You talked about some of the things, Aman, when you mentioned, why people are leaving. And a big one for us is the unique set of resources that HCA nurses can bring to bear on a problem. There's a saying by one of our founders, when we change something at HCA Healthcare, we change healthcare. And that's really exciting because of our scale to be part of something that not only impacts the patient care within the four walls of your hospital or your clinic, but it impacts human life across the country. And I think that's something that's unique to us, and about being that employer of choice. People want purpose, and I think we've got an opportunity to offer that like no other.
Got it. Okay. So when we say, when we're interacting with nurses, even at Incredible Health, and we know the number one reason they're changing jobs is, the most common reason is career advancement. That includes nurses that want to cross train to other specialties. It includes nurses who want to move into leadership. It includes nurses who want to leave the bedside, and every other variation in between. And it sounds like your teams have created programs that enable nurses to do these transitions easily. Is that, and therefore
Yeah.
you're able to track more nurses. Is that to summarize? That's
Yeah, I would say that's very much true. I mean, we have nationwide
Yeah.
train up programs that allow nurses to go into a skill set or a clinical area that they've never been in before. Director development, executive development, financial development, business case. I mean, anything that the nurse wants to do, we try to make that offering, especially if there's a critical mass of voice asking for it. And that's one of the key things, is listen to your nurses and what do they want to do, and then build the support and the technology and the tools around them.
Got it. Okay. And so we know that definitely ties to your employer brand. So how is it that your teams are telling the HCA story to nurses?
So for the recruitment teams, I think it's really part of the hiring process. And so as our recruiters are talking to those candidates, identifying what's the pain point, what is it they want to do, where do they want to go, and then highlighting the various offerings that we have across the organization that can help them get there. But ultimately, I think a big component of those types of conversations needs to come from the hiring manager and not so much the recruiters.
Mhm.
And so I shouldn't say the hiring manager, for us it's hiring managers, but from the leader that's there on the floor with the nurse. Do they have an understanding of where that nurse wants to go? Do they have the training and the resources to be able to direct that nurse through their journey and make those right connections? That's a really big piece for us of making sure that that nurse gets to live who they want to be and what their journey wants to be in healthcare.
Got it. A very big shift that we've had to drive and coach with the many recruiters that use the Incredible Health platform is they need to sell.
Mhm.
And it has really, the game has really changed in the last, especially in the last 24 months, where if you get a nurse on the phone, the nurse may not, they may not know your brand, they may not have even heard of you, and you got to sell, sell, sell. And that has been a real, I think the HCA team has always done that, frankly, for many, many years. But for other teams, that has been a real shift because they're used to applicants applying to them and having the upper hand. But now it's completely reversed. The nurses completely have the upper hand now, and we need to do what we can to cater to their needs and to tell them what they want to hear too.
Mhm.
All right, so let's switch to the topic of care models, because I know that your team is doing a lot of exploration and changes here. Can you explain a little bit more about how you're creating an environment where nurses succeed, and what's HCA doing with care models?
Yeah, not to kind of beat the same drum here, but I think a lot of it comes back to asking your nurses, what would make your job easier? What's the care model that you want to see? What's the support that you want to see? And, when we've got over 90,000 nurses across the organization, it really allows us to be able to have a breadth and depth of that feedback to make actionable. So we've added in various nurse extenders to help, nurses with caring for patients at the bedside. One of the big things we're focused on is tools and technology. We have an incredible amount of patient data. And so how do we leverage that through our own data intelligence, but also through partners, Google and others that we have to really create a technology program that enables nurses to be able to do what we've always talked about in healthcare, working at top of license and doing their best work. I think a great example, that's our spot technology. It allows nurses to sniff out a potentially septic patient, whereas previously it may not have been brought to the caregiver's attention until it's too late. And so in our EDs especially, having that information and feedback, really allows them to then care for the patients better. It helps set up an environment, I think, that's more attractive to nurses, where they have that level of support, not just from the people component, but also from the tools component. And that drive around those tools and technology is something that's really accelerated here through the pandemic.
Okay, and then are you able to share the specific ways that that HCA is soliciting feedback from nurses? Because that's like the first step, as you described. Yeah.
Yeah, I mean, there's a number of ways. For an enterprise as large as ours, we run into some of the challenges with, like I said, trying to talk to those 90,000. So there's certainly the standard engagement platforms, whether you're using a pulse methodology with higher frequency, whether you're still in the once a year, employee engagement. That's always a good solid forum. But I think where we find the most actionable information is in leader rounding, in morning huddles, where it's a little bit more candid, it's a little bit more real time, and then making sure that we've got a pathway from that nurse at a hospital, whether it's in New Hampshire, Alaska, Nevada, South Carolina, to move that information up the chain to the people who can actually take actions on it. That part proves a little difficult sometimes, but that's really been our focus on how to get that feedback.
Got it. Okay, we'll just take a quick question from the audience because it's relevant to this topic we're covering. So, question from Elise Jones: How has the talent acquisition team engaged in any specific strategies to drive nurse retention in the first 90 days?
Yeah, so we definitely play a role in that, but what I'll say, it's the selection process as a whole and not limited just to us in recruitment. So we've heard about for years the value of assessments in that process, peer panel interviews, bringing other players into that. I think there's a caution that maybe, depending on some of the other questions we might get into, but there's a caution there, I think, with kind of over processing. But I'd say that's really it, is the selling component to get people excited about wanting to be here, which gives us some goodwill once they walk in the door. The assessment component that's based on our specific data and probabilities of success. to how likely is it that this person's going to stay. And then I would argue the bigger thing nowadays happens after recruitment, and it's how well are we onboarding that person, acclimating to them to the department, building those family types of relationships once they're on the unit, getting them trained, and removing some of those early dissatisfiers of I can't get access, where do I park? My badge isn't working, those little things that just are kind of signs of maybe an organization that doesn't have it together. Just making sure we've got all that, ready to go and create that excellent early experience for that nurse.
Okay. One of the more visible or public announcements from HCA recently is buying and owning nursing schools.
Mm-hmm.
And I know that your teams have done tuition reimbursement for a while as well. Can you share a little bit more about sort of like the essentially financial investments your teams are making in nurse career advancement?
Yeah, and this one's obviously a multi-pronged play here, but owning and operating not just a nursing school, but quite frankly, an excellent nursing school that has outcomes that far exceed industry benchmarks in a lot of different ways. It's really exciting for us, from the future standpoint of it's going to allow us to become the largest educator of nurses in the country. And when you think about that, we're already the largest provider. We're already the largest educator of physicians across the country. And now to be able to say that for nurses, it's a great story. But then for our existing nurses, being able to offer, extremely low to no cost tuition to become a nurse on the front end, or to advance your nursing education. That's something that I think you're starting to see a lot more hospitals try to offer through partnerships. But we're able to not only do it all in-house, but also to ensure a level of education quality because of the control that we have over it, and be very responsive and reactive to the needs and the desires and the voice of our nurses and what they want to see. So those I think are some really key things of the investments that we've made there.
All right. Okay, let's dive deep into the topic of talent acquisition and building the teams and processes and talent acquisition, which is basically what you've been spending the last decade plus on. Look, as a leader yourself, strategically, like how do you think about building a world-class talent acquisition team?
It's a big question. There's a lot of pieces to it, and so maybe just kind of looking at the recent past. We've got the pandemic challenges with hiring, which I think has led to a lot of panic in the recruiter market. We've seen some of the seasonal challenges that tend to happen this time of year exacerbating that panic. And some of the companies and industries that we kind of follow and watch closely, we've almost seen this overcorrection and over pursuit of recruiters, which I think has made that challenge in the recruiting labor market a little bit more difficult. But as you look at it, I think now especially, you've really got to be open to hire for aptitude, ambition, a core skill set, someone who can influence in a highly matrixed environment. And if you can do that, we can teach you to recruit. We can teach you, how to make the phone calls, how to have the interactions, how to use an ATS and those other things. And then once they're here, people stay as part of their team. And so from a staffing standpoint, I think that's been a big focus of ours, in the last 12 to 18 months. But you see it in employee engagement surveys for nurses too. I stay because of my team. You see the same thing in the exit interviews. I'm going to miss my team. And so for me, I spend a lot of time thinking about, how do we support not just the individual recruiters, but support that team, removing the obstacles, the training, the development, and really pushing that team concept, because in the end, recruiting is a team sport, not just limited to recruiters, but managers, compensation, executives, and everyone across the board. And so how do we create a system that's engaging, that allows recruiters to do their best work? That's similar to top of license, comment about nurses earlier. Those are, I think, some of the things lately, at least in terms of really building a strategic TA function. The data, the metrics, the technology, the process, all that is certainly important. But I'd say in the last 12 to 18 months, it's really been a people focus.
Okay, so let's say you've hired these highly sought after recruiters. They're on your team. How do you ensure they're successful in their role?
Yeah. So, I mean, the easy answer is obviously the training and the development, but kind of going back to fostering that team environment, I think really making sure that they feel welcome on the team, that they understand the value that they contribute to the organization on a daily basis. Everyone likes to know they're doing a good job. It's a very simple thing that I was once told by a leader that has resonated with me ever since. And so ensuring they understand that value, I think adds a lot to it. And then going back to the process, the tools, the technology. We want to focus on things that make their job easier, that allow them to do the high value tasks of manager interactions strategically. How are we going to staff this department? The hunter gathering type of approach to recruitment. So I would say those are some of the key things. That's a big question with probably a lengthy answer.
Yeah. Okay. So let's dive one level deeper into the topic of speed, hiring speed, which, your recruiters are driving that, but as you said, in collaboration with hiring managers and, other parties too. One of the things that surprised us when we started Incredible Health, we had made the incorrect assumption that the hospitals and health systems with the biggest brands, or the hospitals and health systems with the highest compensation, were going to hire the most, and from our platform or in general. And it turns out that that's not at all the case at all. And it's the teams with the fastest speed, with the most streamlined internal hiring operations, that hire the most. And I hope you don't mind me sharing this, but HCA is very successful on our platform because of that. Certainly don't have the biggest brands in your markets, in every one of your markets, and certainly don't have the highest compensation in the markets either. And in we notice this in California and Texas. I mean, there could be an academic medical center with the highest compensation down the street, and the HCA team is still hiring more. And so that really opened our eyes, frankly, to the importance of operational speed and hiring. And the data in our platform shows that 68% of nurses accept the very first offer they receive, and 61% accept the very first offer they receive, even if the second or third offer has higher compensation. And there's something around, majority of nurses, when they're looking for a job, are already working. In fact, they're overworked. And so the teams that are creating a really streamlined, positive candidate experience where they're moving through quickly and they always know where they stand and so on, are winning. Love to hear how did you achieve this, and sort of how are you thinking about maintaining it too?
Yeah. I'm glad you mentioned that. I was going to say that I would like to think we played a role in helping you understand that dynamic in the market, but you,
Yes,
you said that already. So.
Yeah.
And a lot of the framework for that was here at HCA before I got here. HCA Healthcare has always been, I think, a very operationally sound organization. But it comes down to, developing and designing a process that makes sense. Holding all players in that process accountable to their specific tasks or roles within that process, and then never being satisfied with the process being good enough. I talked about it earlier. It's been a big focus of ours, in the last 18 months, of continuing to iterate, continuing to drive that accountability and speed into the process, because it is a big benefit for us. So.
All right. So I want to just go through a couple of scenarios that come up, not just at HCA, but health systems across the country, and would love to hear how you tackle them. One, let's just go with the one that comes from the hiring managers. Let's say you have hiring managers that are saying, hey, we need to do 3 interviews before we make an offer. We're going to need 2 assessments. We're going to need an on-site visit. They're layering in more and more steps in the hiring process. How does your team tackle that challenge? And I mean, the nursing managers, of course, they mean well. They think it's going to improve the outcomes here, but love to hear your thoughts on that.
Yeah, and going back to, we're not immune to some of the same things. I'm sure in your organizations you're probably seeing this. It's this desire of, retention may not be great, or something's happening that I don't fully understand. So my immediate reaction is, well, let's control it, and that ultimately tends to lead to over processing. And so we've been, I think, very sensitive to that as an organization, to where our process works. We make good hiring decisions. And so by adding in these additional layers and interviewers and, multifaceted things, it really does pose a challenge to getting through the hiring process. And in this labor market, candidates don't want that. They don't want to go through 5, 6, 7, 10 interviews just to get to the finish line, whether it's good or bad. So I really view at HCA Healthcare, our recruiters as the first line of defense for that. They're the first ones that are going to see it if we have those types of conversations taking place. And so making sure that we're escalating that up through the chain of command, that, the managers and directors and myself are aware of it. And then we can take whatever the right action may be, whether it's a reminder, a training, a full-blown strategy discussion with data, to keep the process to what makes sense, and not get into that game of really, if we put them through this, it's going to lead to a better hiring decision. one of the things that I'm really appreciative is you're starting to see a lot more data come out from in the research that there's a threshold, and once you cross it, and I don't remember the exact number, it might be 3 or 4 interviews, but there's a threshold, and once you cross it, the iterative gains or value added to the selection process is negligible, and so why do it? And so we try to adhere to that when we're working candidates through.
Yeah, we did find one of these studies. It's one study says 3, the other one says 2. And if you're more than 2 interviews or more than 3 interviews, every additional interview is diminishing returns, right?
Yep.
It's not adding any value. All right. And so let's go into this topic of data, right? So you mentioned, a way to have that discussion, which sometimes is strategic, but sometimes can be difficult, is to share the data. Love to hear a little bit more about how the talent acquisition teams at HCA use data for nurse hiring.
Yeah, I mean, so in a number of ways, but I'll maybe stick to the process component here since we're talking kind of about speed and getting through. We share it loudly, with anyone that will listen, because like I said, it's a team sport. It's not just recruiting data, it's all of our data and getting candidates through the process. And so as you look at each of our hospitals, there's different players in each facility, and there's a different dynamic across the leadership at that hospital. And so taking the information and the data around our process, sharing it not just with the recruiters, but with those key players at the hospital, with those hiring managers, so that everyone understands this is what's happening. And then of course, bouncing that off of, in the labor market we're in, is that fast enough? Does that make sense? Are we doing the right things? How do we change that if we're not looking at the right thing? And so those cycle times, throughput, entrances, exits, top of the funnel, middle of the funnel, candidate utilization, all these various things. One of the challenges we found in looking at that data is it's often limited to the measurements of your ATS. But we all know ATS buckets or categories or steps or statuses, whatever your ATS calls them, they don't match the real world per se. And so being able to take that data that comes out of your ATS, and identifying, okay, what's really the issue within this sub-process or sub-cycle, and going through that diagnosis and sharing it. And then as a team with the hospital, fixing it, saying, here's the data. It's not a blame game. It's, my supervisor always likes to say, let's get serious on the issue and not the people. So let's go out and fix the issue.
All right, so you mentioned the ATS and love to just chat a bit more about the topic of technology. Many of the leaders that have joined the call today are often assessing different vendors. Love to hear kind of your philosophy and your approach when it comes to evaluating technology vendors.
Solely from the recruitment standpoint, I would say there's probably 2 questions that I typically ask. And one is, how's this going to impact my recruiters? Does it make their job more difficult, easier? Do they realize a value from it? Is the work duplicative? But how does it impact my recruiters? And then the other is, what's the overall value we obviously get from it? Not the value that the vendor tells us we're going to get, but what are we actually going to get that's unique to how we do things here at HCA? So, as you think of kind of candidate sourcing vendors, one of the things that's really important to me, going back to what does this do to my recruiters, I don't want a vendor that's going to throw every nurse over the fence, and actually increase the work that we have to do on our side. So do they take the time to screen the candidates to make sure that this is a good person coming over, which then obviously takes some of the work off of my recruiter. And I mean, for your company, Iman, that was one of the things that I think really caught my eye is, what you do, and how Incredible Health works. It is, one, it takes some of the work off our recruiters, which, like I said, is important. And then the other is, it's something that was really difficult for us to replicate, and I think really for any employer to replicate. The way that you guys approach the candidate market, to have a conversation with the candidate and then bring them to the table to have a conversation with us, is something that would be incredibly difficult, and I would argue maybe even impossible for us to mimic as an employer, just because of the kind of approach vector that you're taking to that individual.
Got it. Okay. Great. So what we'll do, I just want to encourage everyone to keep submitting questions. Let's take a couple now, and then we'll go into the Incredible Health overview, and then we'll have plenty of time at the end for more Q&A. So please do continue submitting your questions. One question that came in is, this is from Michael Mara, how has it changed in generational RNs? So, the switch from the boomers to the millennials to Gen Z, impacted the strategies that HCA deploys for nurse hiring?
Yeah, Pretty significantly. I think a shining example is obviously the acquisition of the nursing school, and kind of jumping into the deep end with both feet into that, shifting to the other side of the supply of the labor pool, or being more intentional, I should say, about that side of the supply chain. But then, and I don't think we talked about this earlier, but segmenting out your workforce, it's a different messaging based on the tenure or the age of the individual that you're going to. So one of the big changes is having to go to that more segmented messaging for the same skill set of nursing. And how are we appealing to the 20-year nurse, the 10-year nurse, and the new grad? And again, translating the value that we bring as HCA to that nurse into the language that they speak instead of our corporate speak. So I would say those are some of the big things that we've done.
Got it. Are you able to share any specific examples on the messaging?
One of the things I tell our recruitment marketing team, I've told them on several occasions, is, I'll get a flyer that's coming through and I know it's going to a new grad campus, is I need this to be a little bit more Instagram, TikTok, and a little less Facebook. And so I think it's those things, as far as just the look and the feel of your flyers, of your collateral, the language and the word choice that you're using, really having that innate understanding of what is the audience going to relate to in the language that they speak in. But everything from our job posts, being simplified and written to a level of understanding that makes more sense for the broader market, to that collateral, to our employee referral campaigns, and launching different tools that make that so much easier for our existing staff. It's really trying to bring it into the language and world of the nurse, as opposed to the other way around.
Got it. Okay. Well, we're going to do a quick overview of Incredible Health. And then Stephen, maybe you could share anecdotes of why you were one of our early adopters, and why it is that you went with us, and then we'll spend the rest of the time on Q&A as well. So very briefly, just Incredible Health, we are a marketplace, we're a career marketplace, and hospitals use our custom matching technology to hire high quality permanent nurses at scale in less than 20 days. We guarantee less than 30 days. As everyone on the call knows, it's normally taking a lot longer than that these days. In terms of what we do, there's a few unique things that we do. Number one, the employers are applying to the talent instead of the other way around. As you can imagine, the nurses absolutely love that. Okay, so let's take an example of one of Stephen's markets. Say your San Jose or Bay Area market. When nurses are on Incredible Health, the employers are applying to them in that area, and the nurse gets to choose which interviews to accept and which ones to decline. And so they're hearing from HCA and Kaiser and Stanford and so on, and they get to choose which interviews to accept and decline. As you can imagine, the nurses absolutely love that. Secondly, we have proprietary sourcing. So the way we source, the way we attract nurses to our platform, the biggest thing is the value proposition. Hey, employers are going to apply to you. But it's also very important that we offer a whole range of free services and tools to nurses. We offer free continuing education to every single nurse in the country. We have free salary estimators. We have an advice network for nurses where they can give each other advice, essentially a community within our apps. And so it's important that we do more than just like what is considered traditional recruiting marketing. And then in addition, we have proprietary screening. So with using our software, our data, as well as our humans, we are pre-screening or pre-vetting the talent before they're being put in front of the employers. And then that's where the custom matching kicks in. For every single employer we work with, we create custom matching algorithms. So let's say it's a recruiter named, Gloria on Stephen's team, with a specific recruiter in the San Jose market. It is important that when Gloria logs in, she does not see 200 nurses. She needs to see 12 that are the exact right fit for her at that time. And her peer, say for example, Carol, right, has a different list. So, and it's the same from the nurse perspective. If you're a highly sought after ICU nurse or OR nurse, like you don't really want to hear from 100 employers. You want to hear from 4 or 5 that are the right fit for you. And then the last piece is data analytics. I think for the HCA team, our data analytics are probably just supplementary, but for some teams that are behind on their analytics and don't track as much data as they would like, they are using these analytics to really track cycle times, the number of days candidates are spending in each step of the process, and most importantly, how they're comparing to benchmark. How are they comparing to the rest of the marketplace? Because we're often working with our competitors as well. We are already used by over 500 hospitals and health systems across the country, including very big ones like HCA and Kaiser Permanente and Baylor Scott and White and others. We work with many academic medical centers too, like Stanford and Cedars-Sinai and NYU, Johns Hopkins, and lots of community hospitals too. At this point, we've worked with union, non-union, magnet, non-magnet, academic community, like every iteration at this point has been successful on our platform. As far as like how we work together, this is a true collaboration. We fundamentally do not believe in outsourcing. I know, Stephen, that your team also doesn't really believe in RPOs and fully outsourcing talent acquisition, especially for these roles that are hiring for nursing is complex. It requires a lot of internal stakeholders. And so we believe in really strong talent acquisition teams, and we are partnering with very strong talent acquisition teams that are already internal and already trained and built up. So this is the 8 steps of the hiring process. We're doing a lot of the heavy lifting in the first 4 steps for experienced and specialized nurses, sourcing, pre-screening them, making sure they're interested, and getting that first phone screen with the recruiter automatically scheduled. At that point, the in-house talent acquisition team is completing the phone screen, getting hiring manager interviews scheduled, sending offers, and getting offers accepted. And so this is their normal hiring process. Essentially, this is a true collaboration. Many talent acquisition leaders are adopting this model because for several reasons. Number one, it frees up recruiter time. Recruiters, just like nurses, need to be operating at the top of their skill set, at the top of their licenses. And what they do best and what we need recruiters to be doing is talking to candidates, building strong relationships with hiring managers. Some of this administrative work around sourcing can, frankly, these days be handled by technology. And so we've partnered in this way. These are some of the results we replicate. This is a team in LA where we really got the days to fill from 66 days down to 19 days. Where we have the biggest impact is on time to source. Usually that is the number of days where it's really dragging out the days to fill. And so for this team specifically, we got it down from 44 days to down to 3 days. And that's really what's driving the speed in days to fill. I mentioned earlier that 68% of candidates accept the very first offer they receive, and 61% of nurses accept the very first offer they receive, even if the second or third offers have higher compensation. We found that this to be true in every single market that we operate in. We're in 22 states across the country right now. And speed is definitely a competitive advantage. And then more recently, we've been starting to track retention, especially at the 1-year mark. What we're seeing is that the retention of nurses hired through Incredible Health is 15% higher at the 1-year mark compared to traditional channels. A lot of that has to do with the fact that the nurse was able to consider multiple opportunities before selecting your hospital or your health system. So it was a very well thought out and thorough job search, as opposed to, hey, I'm taking the first thing I can get. And the custom matching also helped with that as well. All right, so want to open this up for Q&A. And there's a few questions that have already come in. One thing I wanted to just ask, Stephen, you were one of our early adopters. We were only in California at the time when you started working with us, and now we're available in many states. Would love to hear your thoughts around why did you give us a chance? Basically, why did you go with us at the time?
We had a great salesperson at the time, so I don't know if you remember that. No, really for me, I think I touched on it earlier, is the process, even at that phase of your own company development, it didn't add work or quite frankly didn't have garbage being thrown at the recruiters that I was working with at the time, to then make their jobs more difficult to have to do that sifting. I mean, you were doing the pre-screening, and that was one of the things we watched very closely early on in those first 2 weeks, is what is really the quality that's coming over the fence. And if it's not to a sufficient level, we'll cut bait and move on and try something else. But it was, and so obviously we continue to use you guys. The other thing, and this was probably the biggest of the ones, and I touched on this one earlier, is you were able, so you mentioned all the different ways that you engage with the nursing population through CEUs and all these different things that you offer to them to kind of get them into the platform. That's something that, one, would have been very difficult for us to stand up in a reasonable amount of time and at a reasonable cost. But two, even if we were to do it as an employer, the impact and the perception that the nurse would have had coming from us versus coming from a neutral third party, I am of the belief that it would not have had the same result. And so in doing that, I mentioned it gave us the opportunity to have a candidate come to the table for a conversation where I then had faith, yes, in our process, but more so in our recruiters to have that meaningful conversation with that candidate to explain to them some of the value propositions I spoke about earlier for HCA, and to get the candidate in the door and have them join the family. And so those were, I think, probably the two biggest things that I thought about at the time, at least, as to why it made sense for us.
Got it. Okay. Fantastic. So we'll take a few questions. Just a reminder to everyone, if you have questions even after this call, please feel free to submit them at questions@incrediblehealth.com. We also monitor our Twitter and our LinkedIn. So if you wanted to follow us there and also submit questions there, we're tracking that as well. Ali can share our Twitter and our LinkedIn in the chat now as well. So, one question that came in for you, Stephen, was about hiring events and sort of how you're thinking about that as part of your talent acquisition strategy.
Over the last probably 2.5 years, so pre-pandemic, I would say hiring events have become a lot, I guess, a lot more ingrained in the way that we approach the candidate market. I definitely won't say that we were the leader in hiring events prior to that. And I still continue to sometimes see healthcare systems out there that do it potentially better than we do. Similar events, but going big, stadiums, sexier venues, going for kind of the big bang and the wide net. So I think that we still got some opportunity there, but generally speaking, the way that we run hire events has been very, very successful. We tend to try to be a little bit more targeted in the audience that we're going after, engage with them at a bit more of a meaningful level. We occasionally do the wide net approach as well. I think one of the things not necessarily unique, but somewhat unique to us at HCA Healthcare is, we have to really look at the value equation. We have to be a little more cognizant of ROI. If we're going to go run an event, what are we going to get out of it? Outside of just awareness, but no, it's very much become a more integral part of our strategy.
All right, fantastic. Yeah, we've also started collaborating with teams on hiring events too. And so now we have a sort of an operational workflow inside our marketplace where candidates that have been custom matched to the team can also attend hiring events that have already been pre-scheduled and as well. And we found that to be powerful, combining talent acquisition strategies. Another question that's come up is you mentioned assessments earlier in the interview process. What do you mean by assessments, and what's actually happening in this? What's the value of this assessment that's in some of your hiring processes for nursing?
Well, I think as long as assessments have been around, I think there's still some debate in that, depending on the assessment, the role type, like basically the specifics of the situation. I think generally there's value there, but then it's looking at the specific circumstance. But we use them to help identify a number of things. But the thing you typically hear about is the fit, which I know can be a dangerous word sometimes. But as we've looked at our own internal people, our own high performers, what are some of the traits, the tendencies, the competencies that they have, and then how do these potential candidates stack up against those? And so we're looking for, from a skill set standpoint, at least, what are things that have proven to be successful? The danger there, obviously, is you get a lot of more like me, just like people, and so we have to be sensitive to that too. We've got a large diversity and inclusion focus here at HCA. We believe it adds a lot of value to the conversation we have, not just about our own organization, but the culturally competent care that we provide to patients in all of our markets. So it's one of the things that we have to balance with that assessment too, and that more like us thought process.
Got it. A very specific question came in around offers and the speed to sending out offers. Are you able to share at all how, if you're able to share, hey, what's your average time to getting an offer out to a nurse, especially an experienced and specialized nurse, and sort of what are the things that have sped that up or caused delay there?
It's a tougher question to answer than maybe as simple as it sounds. One, because of our geographic dispersion, the number of different markets, each has its own kind of unique component to it. And then two, just because of some of how our requisition flows and position management and things work within the company. Generally speaking, yes, we certainly have offers we get out in a day, but that's usually a known candidate. But I would say it's probably in that 30 to 40 day window from the time a position is open to where we have no idea who we're going to hire until an offer is going out the door. And then I'm sure it spans the gamut of 0 to, obviously a much larger number and everything in between. So.
Got it. one of the topics, another question that came in is one of the topics driving the nurse shortage is not enough teachers or not enough faculty at nursing schools. There's not enough nurses training other nurses. Curious if you had any detail around how HCA is thinking about that and solving that, especially as you're buying more and more nursing schools.
Yeah. So it's the biggest solution I would say is obviously the nursing school acquisition and our partnership with Galen that I talked about earlier, and so really trying to get more involved with the upstream component of educating nurses. Outside of that, there's a myriad of tactics as to how do we plug education into our educators and our staff into that education pipeline to maybe help provide some additional capacity. Or there may be financial resources that make sense that benefit the community as a whole, the school, us, and the individuals within the community. So it's not a one size fits all approach. I think it depends, going back to being in so many markets, what's going to be the right decision for that market that adds the most value for all the players. But yeah, no, we're obviously trying to do everything that we can to do our part to aid in that capacity increase for nursing education.
Got it. You had mentioned earlier the topic of the phrase nurse extender. I think there was a question about what is that? Is that a nurse or is that someone else? Or yeah.
There's a number of different roles. I mean, your sort of PCTs, your CNAs, your LPNs, your LVNs, even your unit secretaries. You could make an argument there, but it's those individuals that help provide support to the nurse without actually being a nurse themselves.
Another question is just around flexible scheduling. This is scheduling, just the scheduling of nurses after their shifts and so on is can sometimes turn into such a contentious topic. And one of the challenges that some of the teams we work with have is, hey, we gave preferential treatment to the nurses who are already here. They already took all the day shift positions. Therefore, there's only night shifts left. And by the way, we're only going to do 12-hour shifts 3 days a week. And that's the only option. And so we only need ICU and OR nurses in the night shift, 12 hours, 3 days a week, just very rigid. And that makes the job of talent acquisition much, much harder. Curious how you think about offering flexible schedules and, opening up more part-time roles and sort of how you've tackled this challenge.
Yeah, and just as a heads up, if I lose you, I can hear my headset battery beeping at me. So, but
okay.
It's a big problem, and obviously trying to tackle it at scale has proven challenging for us. But we talked earlier about nurses working how they want, when they want, where they want, and that when is really the component that fits here. So we've been very intentional about the offerings that we bring to market for our nurses, from a minimal commitment to the organization where you work when you want. You tell us when you want to be here and we're happy to have you as part of the family, to you want to be fully committed to the organization and working those 312s or more of the standard or traditional shifts and everything in between. So we've really tried to provide that variety to kind of back up our talk of working when you want. As far as part-time, full-time, it's allowed, or it's not allowed us, it's really put us in a situation to have to get really creative about the needs we have as an organization and what is the labor market going to supply. And if we're not able to find that balance, how do we solve for that problem? And that's almost a mini case study each time it happens in and of itself, is how we're going to solve for it in that location with that candidate supply.
Got it. Thank you. Okay, another question came in back to career development, nurse career development. You highlighted earlier that, hey, basically your team does whatever you can to support a nurse's career. I guess the question came in from Shauna. Can you highlight a little bit more their ability to move simultaneously, vertically and laterally? Like, what are the specific initiatives and programs you have in place to support career longevity?
Okay. Again, somewhat unique to the nurse and the direction they want to go, but generally speaking, as you think about the clinical world and that kind of moving laterally or from one specialty to the other, we have a nationwide training program where we bring it to the nurse, and it allows them, where we train them up on all the things they need to know about that particular specialty. We pair them with a preceptor. We put them through a training program that allows that transition to be smooth and easy. And then if you look vertically, we've got, like I said, various layers of development programs where individuals can self-nominate, they can be nominated, and then they're selected to move into these training programs that teach, depending on the level, really kind of what those core competencies are to get them to that next level. Is it time management? Is it difficult conversations? Is it, operational rigor? What is it they need to learn to take that next step? And again, those exist at a national level. But we bring them down into the facilities and to the nurses. We also obviously have our L&OD teams that work on a one-on-one basis with various hospitals or units on specific one-off things. Is it crucial conversations? Is it how to do better leader rounding, whatever it happens to be. So it's multifaceted, but we do try to make it as nurse-driven as possible so that they can set their own journey.
Got it. Okay. I think we've addressed a lot of the questions. Thank you so much for your time today, Stephen. Just as a reminder to everyone, we are sending out this recording, so you will receive it for everyone who registered and attended. And if there's any additional questions, please feel free to email them to questions@incrediblehealth.com or send us a message on LinkedIn or Twitter. Thank you, Stephen, so much for your time and sharing with all of us.
Yeah, of course. Happy to be here. Thanks for inviting me.
All right. Thanks, everyone.